Welcome back to the PCOS Fertility Health Podcast. This is your place if you are trying to get pregnant and you've got PCOS. Hi, Dr. Angela Potter here, your host and the creator of the PCOS Fertility Protocol. I'm also a speaker. I have shared the stage with leaders from companies like Microsoft and Google, and I am overjoyed to be here now with you. And as we get started today, I want you to just acknowledge yourself for choosing to listen to something that's going to help you move even closer to having your baby. And in a world where you are given advice like, oh, I can only give you metformin until you lose weight, or you're infertile and the only way to treat your PCOS is to go back on birth control. In a world where so many women, perhaps yourself, are getting fertility advice like that, you are choosing something different and you are holding on to an ounce of hope to say, no, I know that there is something, a way to help my body get closer to getting pregnant. And you're exactly right. And that's why I'm here with you. And so just acknowledge yourself for taking the time to show up and listen. And even if it's really hard to hold on to hope because you haven't had a period in a year, you've had 5 rounds of letrozole and your doctor is saying, well, I'm sorry, we can't do anything more for you. That's a really hard place to be in. And I will hold on to the hope for you. Okay. I am here for you. I believe in you. And there are ways to move forward step by step in order to help unlock this wonderful chance of getting pregnant with PCOS. So as we dive in today, we are going to be covering the last of the 4 types of PCOS. This one is post-pill. If you're a new listener today, hi, I am so happy that you're here. You'll want to go and listen to the past 3 episodes, the most latest 3 episodes, so then you can get all the information you need about the different PCOS types. Today, we are talking about post-pill PCOS. And figuring out your PCOS type is one of the first steps in order to then move forward with an individualized fertility plan that's going to open up your chances of getting pregnant. So post-pill PCOS is pretty straightforward. It means you've been on hormonal birth control, and then all of a sudden PCOS symptoms show up once you stop that hormonal birth control. And I see this show up really in 2 different ways. So the first way is that somebody has totally normal periods, regular periods, no signs of any hormonal imbalance, not a lot of acne, not a lot of even like PMS symptoms, just totally regular periods. They go on the pill for a few years and then they come off and all of a sudden it's like a switch and they're getting lots of acne, easy weight gain, periods are not regular, and they're in this PCOS picture. The second way I see it show up is for somebody who, before getting on the pill or hormonal birth control, their periods aren't regular and they can say, I remember things not being regular, and maybe that's the reason they got onto birth control in the first place. But also they weren't having a lot of other symptoms, not a lot of acne, not easy weight gain. And so they were potentially in that PCOS picture, but then they got on birth control, then got off of it, and it's like things just went from 0 to 60. And again, lots of that easy weight gain, acne, periods don't come back at all, things like that. So those are the 2 most common ways that I see this pop up. Now, I do also want to mention that not everybody who goes on hormonal birth control comes off it and gets into this PCOS picture. But for people who do, because as we're going to dive into in just a minute, there are ways that the synthetic hormones then push your body into that PCOS state because it's coming from that medication that you're taking, that birth control. It can be the easiest PCOS to turn around. And in fact, many doctors will just say, well, you need to wait a few months and things will turn around. For many women, that happens. And it does take 6 months to a year for hormones to come back into regular balance after birth control. And then you move away from that PCOS picture. That's why I'm referring to it as a PCOS picture right now, because it is the one that's most transient. For other women, it just sets them into PCOS. It's like a light switch, and they're just in there with that hormonal imbalance, the fertility issues moving forward. And it's really important then that you take the time to help get those hormones back into balance. Even if you're in that 6 to 12 month window where potentially your body could go back into that, regular hormonal pattern, you can still be actively supporting your body to bring those hormones back into rhythm. You don't have to wait. Birth control is recommended for many women with PCOS when they're having irregular periods. And birth control has become one of the top recommendations to help get periods regulated. But it's a big red flag because those synthetic hormones are doing things in your body to shut down fertility, right? I mean, that's its job, is to keep you from getting pregnant. So it's shutting down your body's own production of these baby making hormones. And yes, it looks like you're having a regular period if you get that withdrawal bleed once a month, but it's not actually setting your body up for regular hormone patterns because, again, its job is to keep you from getting pregnant. And if it was creating this beautiful natural rhythm of hormones to get you to have that regular bleed once a month, you would be getting pregnant. Okay. And that is not the goal of birth control at all. So, what it's doing is shutting down your body's own production of estrogen and progesterone. And it's telling your brain, hey, we've got this covered. You don't need to do anything. And so it's just shutting down that fertility pathway in your body, keeping you from being able to get pregnant. And there's really three top areas that the hormonal birth control sets you up for PCOS once you get off of it. So, number one is that the hormonal birth control raises androgen levels. And the androgen levels, testosterone is probably the one you're most familiar with, right? Those are the male pattern hormones that when they show up in female bodies, like you and me, that then it's shutting down ovulation. It's not allowing your estrogen and progesterone levels to be what they need to be in order to make a baby. And so for somebody who comes off of hormonal birth control, because the brain and the ovaries have been shut down for whatever length of time, it takes time for things to wake back up. And in that process of the estrogen and progesterone trying to come back into regular rhythm to be like, oh, okay, now we need to start producing these hormones. What does that look like again? Well, that just creates this beautiful environment for testosterone to rise. And when testosterone is rising, again, that's shutting down ovulation. It's creating that PCOS with the acne and the weight gain. That's what you're going to experience in your body. Having that elevated testosterone is one of the components of having PCOS. So, the second way that hormonal birth control sets you up for PCOS is that it depletes you of important nutrients that your body needs for that regular hormone balance and for egg quality. So we know that the pill depletes important nutrients like vitamin C, B vitamins, folate, zinc, CoQ10, some key vitamins that are needed for the hormone balance and egg quality. Let's talk about CoQ10 just for a second, because we also know through research how important CoQ10 is for your mitochondria that are in your eggs, helping your eggs develop to get to that mature state. So then they are ready to ovulate. If you do not have enough CoQ10, then your eggs aren't able to divide those chromosomes and get to a place where they are mature. And so research has found that the research studies that I'm going to mention right now are looking at the pill and how they lower CoQ10 significantly and tocopherol levels, which is another sign of antioxidant status. And so in the women who were taking the pill versus women were not, those on the pill had significantly lower levels of CoQ10 and tocopherol levels, showing that the body's antioxidant status was lowered through taking the pill. And if then you come off the pill and you are continually depleted in that CoQ10, those other antioxidants that are needed for ovulation and for egg quality, and nobody is helping you to replenish those levels, then your body is again going to have elevated testosterone because you're not going to be able to ovulate. Your periods aren't going to come back because you aren't ovulating. You don't have the nutrients on board to allow those eggs to get to that mature spot. And the third way that the hormonal birth control sets you up for PCOS is that it increases insulin levels and decreases insulin sensitivity, which basically just means it sets you up for glucose issues, for blood sugar imbalance, raising those insulin levels, which again increases testosterone and then shuts down ovulation. Women who have diabetes, who are looking for a type of birth control, need to be counseled on the benefits and the drawbacks specifically of hormonal birth control and how that's impacting their insulin levels, because we know how much the insulin levels are increased when on synthetic estrogen and progesterone. And so for somebody who doesn't have PCOS, who gets on hormonal birth control and then develops that insulin resistance because of being on those synthetic hormones, well, then coming off of the pill, that your body has then been trained to be in that state of insulin resistance. And you come off the pill, that insulin resistance then is pushing those testosterone levels, shutting down ovulation, keeping you from having regular periods. And your body just needs to be retrained in order to bring those insulin levels down and balance that blood sugar. So for post-pill PCOS, when you're figuring out your PCOS types, there's really two questions to ask yourself. Number one, have I ever been on hormonal birth control? Yes or no? And number two, what changed for me after I came off of that hormonal birth control? What changes did I see? Did I get any symptoms like acne, easy weight gain? Did my periods not come back? Things like that. And if those are a yes for you, then you need to be exploring an important treatment plan that then helps bring your body back into regular hormonal balance. So that wraps up our 4-part series covering each of the PCOS types. I am just so happy that you were able to be here and join me here. Join me next Wednesday. If you are somebody who has not had a period in a year, next week's episode is going to be for you. And as we wrap up here, if you are loving this episode, could you please head on over to Apple Podcasts and put a positive review? That means the world to me, and it helps this podcast keep going round. And as always, I want to remind you that this podcast is just for informational purposes. If you are working with a healthcare practitioner, this information should not replace the medical advice that you're getting from your doctor. If you're not getting the kind of advice and fertility plan that you are hoping for from your doctor, then you can always reach out to work with me one-on-one. You can head over to drangelapotter.com/PCOS and sign up for a fertility breakthrough session with me, and we'll talk about your situation, what's going on, and how I can help. And as you go forth this week, just want to let you know that I'm over here cheering for you. I absolutely believe in you, and I believe in your ability to improve your chances of getting pregnant with PCOS. Mwah. Have a beautiful week.